Thank you, Virginia, and thank you, Will Humble. Thank you, Arizona Department of Health, for inviting me to this kickoff for March Colon Cancer Awareness Month. I see a lot of blue out there. I got out my blue as well. So it's really important. We had Humble talk about his colonoscopy. I'm not going to talk about my colonoscopies, but I will be a resource for those afterwards if you have specific questions. First of all, this is a really serious topic, and a lot of times we do use humor to cut the ice and to talk about the colon and colon cancer and colorectal cancer. But this is a serious situation, and you'll see the Colon Cancer Alliance and also Fit at 50 that does colonoscopies, and then our table back there as well, that have this little pin that has, a lot of you are wearing it, and it's a blue star. I'm going to talk about the first part of the star, and then we're going to talk about the good news, the second part about the star. The first part of the blue star is eternal memory of those that have lost their lives to colon cancer. And I know a lot of you here have been touched by that. It's serious. It's the #2 cause of cancer death among men and women in the United States. 50,000 people lose their life annually in this country unnecessarily. And almost 1,000 people in Arizona lose their life. This is a silent killer. It's a silent killer because by the time you have symptoms, often it's already metastasized. That means it's already spread to other organs. This is a disease that you don't have any symptoms for. So as Mr. Humble said, get screened. I'm going to say it a couple more times about getting screened, but share that with your family, share that with your friends. You gotta get screened. It's a silent killer. It's an equal opportunity killer. It kills men, it kills women, it kills those of all different races. So it doesn't select people out. So if you think you can dodge this, colon cancer, the #2 cause of cancer death among men and women, you can't. Everyone is at risk. So there is some good news. In the second part about this star, this blue star that many people are wearing, is the bright hope that we can have a world without colon cancer, free of colon cancer. So the first part's the memory, but the second part is the hope that we don't have colon cancer. And there's good news, and Mr. Humble has already talked about his good news, and all of you should be able to share that good news. That good news is there's prevention. There's a screening test that prevents colon cancer. In addition, there are other tests that you can talk with your doctor about that can detect colon cancer at an earlier point in time. Obviously, I'm a gastroenterologist. I've been in practice since 1996. Been back in Phoenix. I'm a native, went to high school, went to U of A. Go Cats. Also, so been back since '99. But again, this is something that I do every day. I identify polyps, as Mr. Humble had mentioned, and then I either pinch them off or I lasso them off. And by removing precancerous colon polyps, which are the growths that occur in the colon that you can see as you walk through here, the knoll in the colon, as we remove those, we can actually prevent colon cancer between 75 to 90% of the time. And once you have precancerous polyps, you then get put in a category that is different than that if you were just screened and had no polyps whatsoever. So colonoscopy is an important preventative screening test. And it's although there was certainly some color comments, different experiences that Mr. Humble had with his experience. I've had 2 colonoscopies, and there's no doubt it's important. You talk with your primary care, you talk with potentially a person who is skilled and experienced in colonoscopies. I've performed 16,000 colonoscopies. So you have people that are experienced in our community who know what to do, and you can talk with your primary care as well. And then talk, as Will Humble said, about the prep options and screening times and so forth. But there are so many barriers that you need to overcome, and you need to share that with your family members specifically. If you have a polyp, it means that your brothers and sisters are more likely to have polyps. If your mom or dad had polyps or colon cancer, you're more likely. Know your family history. That puts you at an increased risk. Turns out that also African Americans should have their colonoscopy done at age 45 instead of 50. So there is prevention. There are alternatives to colonoscopy if you're not interested in undergoing a colonoscopy after you fully understand the risk benefits and then understand the alternatives. And that includes CAT scans, CT colography it's called, to identify early colon cancers, flexible sigmoidoscopy to also remove and identify polyps at an earlier point. And then also there's testing of the stool for blood. But the good news is there's a lot of opportunity, and we've reached over the 50%. We're now at about 60% of those that should be screened are screened. And an event like this today is important to decrease the barriers to care and really resolve some of those misunderstandings and miscommunications about undergoing the examination. So I appreciate the opportunity to kick off Colon Cancer Awareness Month. Wear your blue, wear your button every day for the month of March. Get a friend to get a colonoscopy. One of the things I didn't mention, if someone does have symptoms and they're 40 or they're 38, they need a colonoscopy. If they have blood in the stool, it's rare, it's less common, but definitely talk to your doctor about it, the value of getting a colonoscopy at an earlier age. So thank you again, and I'll be available afterward for any questions.